Hi, I'm Becky and I'm one of the nurses here. I wanted to quickly go over your upcoming laparoscopic cholecystectomy, which is the less invasive way of removing your gallbladder. I've printed off some information for you. This is from the Mayo Clinic. I'm going to give you a copy and I'm going to have them, we'll go over it together. If you have any questions at any time, just stop me and I can give you more information, or let's just get started. So what brings you to have your gallbladder removed is when you're having problems with gallstones, either in the gallbladder, in the ducts, that's either causing inflammation of the gallbladder itself, it's causing indigestion, pain, diarrhea, a lot of upset, or it can even cause pancreatitis inflammation, because the gallbladder and the pancreas are so close together and they both empty into the intestines when you eat. So the laparoscopic gallbladder removal is much less invasive and more used now. It's only 4 small incisions made into your stomach. The 3 of them are made just under your ribs on the right side, where the gallbladder is located, right under your liver, and then one right above your belly button. They put 4 small scopes in. That's why it's called laparoscopy scope. And they go in and they can actually put their tools inside those scopes and they can remove what they need to. So that's done within about an hour or 2 in surgery. And let's go over what happens before, during, and after. So before surgery, for this surgery you're going to need a general anesthesia, so you're going to be asleep. So what they recommend, because I know you've already spoken with the doctor about medications, what you can and can't take before, if you're on blood thinners or any kind of medication that would contraindicate a surgery, because this is, even though it's less invasive, it's still a surgery. And we will also be NPO, which means nothing by mouth, after midnight before the surgery. So in some cases, some physicians will say that you can have your morning medications with sips of water. It all depends on the surgeon, but we can also go over that afterwards if you'd like. So we're going to be nothing by mouth, because you're going to be asleep, and this makes the risk of aspiration when you're sleeping less. So what we're going to do is you're going to come in, all your consents are going to be signed, you're going to come in, you're going to get your medications. They usually give you a dose of antibiotics before they make an incision, because it's going into your, they're going into your belly. I also wanted to tell you too that at some times, I'm not saying this is going to happen to you, but I just want you to know everything that they have to do. They go in with the laparoscopes and they have to actually do a traditional cholecystectomy, which is they have to make the incision in your stomach, about a 6-inch incision, to take out the gallbladder that way. And I'll show you, I have a picture for you too, that you can take with you to look at the 2 different of what your belly will look like afterwards. So during the operation, like I said, it takes about 1 to 2 hours respectively to complete the procedure. It's if everything goes as planned, you should be in recovery, and then once you wake up, they will get you up and moving. Usually with the laparoscopic gallbladder removal, you can go home the same day. If it happens that you have to have the traditional gallbladder removal, then you could have a hospital stay of 3 to 5 days. Some risks of having an open gallbladder removal are obesity, if there's some scarring, if you've had surgeries in the past, scar tissue in the area, those could be reasons why they would have to do an open gallbladder removal. But we can also go over that again, or I can get you more information from the physician. So once you've had the surgery, you're in recovery, you know, you've planned ahead to have someone, of course, take you home, care for you for the next few days. You're going to need to take it easy. You're going to be uncomfortable. Usually after this kind of a surgery, after a laparoscopic surgery, usually they give Tylenol for discomfort, Tylenol with codeine, which are also called Tylenol 3, and that's for like moderate to severe. In severe pain, they give Vicodin, which is hydrocodone and Tylenol together. That's for abdominal discomfort. Also, I wanted to go over too that when they do the laparoscopy, they do put air into your stomach. So sometimes after, a lot of people experience some gas pains that can be relieved with movement, and you've just had a surgery, so it's really important to keep everything moving and get up as much as you can, quickly as you can, and walk around to try to release that air. So now that you know about that, let's see. I also wanted to talk to you about diet. So afterwards, since your gallbladder really isn't essential for digestion, they still say that some people report diarrhea, loose stools after the surgery. So they found out, and I've known from people personally that have had this surgery, that because of the bile that's concentrated in the gallbladder, now that you removed it, so now the bile is going directly into the intestines, and that helps digest fats. So if you have a meal that's high in fats, your body senses it, sends out a lot of bile, and it almost has a laxative effect. So they recommend that you have a diet after surgery, or even before too, I'm sure. But now that you've had the surgery, they say a diet low in fat, have small, frequent meals. Try not to overload your GI system with a large meal, because then all your organs are like, whoa, there's a big meal, I have to send out everything, even your pancreas too. And irritants like caffeine can irritate your GI system. I also wanted to talk about too, after surgery too, incentive spirometry. You may be really uncomfortable in your stomach, and the last thing you're going to think about is getting pneumonia, but you want to keep your lungs expanding too, because you don't want a complication like that. I also wanted to show you, I made you a picture. This is an abdomen. This is your belly button. See these little pink stripes? Those are where your laparoscopic surgery would be. Those are where the ports would go in, where they would put each one in with a small incision. And those are actually most of the time closed up with surgical glue. There's not even stitches. And then they'll put like some little steri strips over it, and you can just let those fall off, because everything's closed. If you for some reason have to have an open traditional gallbladder removal, then I just wanted to show you under the right ribs, this is where the incision would be, and you would have staples or sutures to take care of. I just quickly want to go over signs and symptoms of infection, and then we can stop and you can ask me questions. If any of the incisions or where the ports were become red, irritated, if they have any drainage, you need to call us right away. If you have a fever, if you just feel like something's not right, you need to call, nursing or the doctor right away. So that is it in a nutshell. If you have any questions, you can stop me now, or if you want to, I can give you more resources to look up. Thank you.